My name is Carlos Ivan Ramos. I'm the Executive Director of Cleveland nonprofit community-based agency that is called Hispanic Umadaop. Umadaop is the acronym for Urban Minority Alcoholism and Outreach Programs. And we have been in existence for 21 years. It's unique because it is very much has a grassroots history within the Hispanic community in Cleveland, and it's community based. So we have three buildings in the Clark West 25th neighborhood, where it's a strong Hispanic community, where we provide our services. Recently there was a report that ranks Cleveland as the second poorest metropolitan area in the country, following Detroit. You put that fact plus the Latino youth in Cleveland has one of the highest dropout rates in the country, somewhere in between 55 to 60% dropout rate. And when you combine that with the availability of drugs in our neighborhood, then it creates a formula for a lot of our youngsters engaging in drug abuse. In terms of the HIV, the latest reports that I saw from the Cleveland Department of Health puts around 3,000, a little bit over 3,000 registered individuals living with HIV/AIDS in the city of Hispanic descent. A lot of the individuals that acquire this disease is mainly by three risk factors. Number one is men having unprotected sex with men, by heterosexual relationship with unprotected from mainly male, and intravenous drug use. Cleveland is, in terms of this last factor, the intravenous drug use, we have a collaboration. Hispanic Umadaop have a collaboration with the free clinic, where they come to our agency. Our agency is a site for needle exchange. It's a needle exchange program, and so the individuals can come to our site through the free clinic van and exchange needle to reduce the risk of spreading HIV. Cleveland is one of the few cities in the country that this program is legal, and law enforcement do not intervene with the program, and it's accepted. So that's one, I think, a major component of how we are, and the city and organizations that deal with addiction are trying to reduce the spread of HIV/AIDS. Correct, because of the factors that I previously described. Let me also mention, in terms of what we see in our agency, that put a little bit of more perspective. We are seeing younger people coming to seeking our services. Many of them with dual diagnosis, meaning that in addition to having an addiction problem, they also have mental health issues, depression, schizophrenia. So it's a more complex scenario of how to treat these individuals. The drugs that we see most often used by the individuals seeking our services are alcohol, marijuana, heroin, and cocaine. So those are the characteristics of what we are seeing: younger, and having dual diagnosis, and using the type of drugs that I just. But at the same time, once they seek our help, when they recognize that they have a serious problem and they have to change their life, or a relative help this person redirect the individual to seek our services, we see how once the individual is committed to seek help, their life changes completely. Um, they become productive citizens. Some of them become small entrepreneurs, starting a small business. They're able to show, once they change their lifestyle, that they can take care of their children and reconnect with their children, and maintain their sobriety. In some cases, they might relapse 2 or 3 times, but for the most part, when there's a strong commitment from the individual to change their lifestyle and recognize that addiction is a disease and seek the treatment, they change their lifestyle and become productive citizens. So treatment works, and people that wants to change their life due to the addiction problem, they can do it. So that, in a nutshell, Tony, is what my experience being in this field for the past six years. You don't have to be a Hispanic to seek our services and our help. If we cannot help you because we think it is not within our scope, we will definitely refer the individual to the right place to seek the help that the individual needs. So the first step will be to call our agency, 216-459-1222, and once you call our number, you will be in touch with one of our staff that will direct your call to an individual that will screen your issue. We will do a brief screening about the issue, and then if we can help, that person will put you into our system in terms of how we can help you. And again, if we don't have the services that the individual needs, we will definitely refer that individual to the right place to seek help. Again, the phone number is 216-459-1222. Our website is http://Hispanic, no space, umadaop.org.